How to understand your cancer staging report and metastasis. When you receive a cancer staging report, it can feel overwhelming, but understanding what it means is key to knowing your diagnosis and treatment options. Cancer staging describes how far the cancer has grown and whether it has spread, which helps doctors plan the best approach for your care. For colon cancer, the most common system used is called the TNM system. This system looks at three main factors: tumor size and invasion, lymph node involvement, and whether the cancer has spread to other parts of the body. The T or tumor category tells us how deep the cancer has grown into the layers of the colon wall. The colon wall has several layers, starting from the innermost lining called the mucosa, then the submucosa, the muscular layer, and finally the outer connective tissue or serosa. If the cancer is only in the mucosa, it is called carcinoma in situ or TIS. If it has grown into the deeper layers but not through the wall, it might be classified as T1 or T2. When the tumor has grown through the entire wall and possibly into nearby tissues or organs, it is classified as T3 or T4. The higher the T number, the more invasive the tumor. Next is the N or node category, which indicates whether the cancer has spread to nearby lymph nodes. Lymph nodes are small structures that help your immune system fight infection. If no lymph nodes are affected, it is called N0. If cancer has spread to nearby lymph nodes, it is classified as N1 or N2, with increasing numbers showing more nodes involved. The number and location of affected lymph nodes are important for understanding the extent of the disease. The M or metastasis category shows whether the cancer has spread to distant parts of the body, such as the liver or lungs. If there is no distant spread, it is M0. If the cancer has spread to other organs or distant lymph nodes, it is classified as M1. The presence of metastasis usually indicates a more advanced stage of cancer. These three factors combine to give an overall stage from 0 to 4. Stage 0 means the cancer is only in the innermost lining and has not invaded deeper tissues. Stage 1 indicates the tumor has grown into the deeper layers but has not spread beyond the colon. Stage 2 means the tumor has grown through the wall or into nearby tissues, but no lymph nodes or distant organs are involved. Stage 3 involves spread to lymph nodes but no distant metastasis. Stage 4 indicates the cancer has spread to distant organs or tissues. Understanding metastasis is especially important because it signifies advanced disease. When cancer cells travel from the original site to other parts of the body, it is called metastasis. In colon cancer, this most often happens through the bloodstream or lymphatic system, commonly affecting the liver or lungs. The presence of metastasis usually means a different treatment approach, often involving systemic therapies like chemotherapy, targeted therapy, or immunotherapy, sometimes combined with surgery or other local treatments to manage metastases. Your staging report will include the specific TNM categories, such as T3, N1, M0, and an overall stage like stage triple. Higher numbers generally mean more advanced cancer. Sometimes the report will specify subcategories like stage IIIB, which provide more detail about tumor size, lymph node involvement, or spread. In practical terms, a lower stage such as 0 or 1 often suggests the cancer is localized and might be treated effectively with surgery alone. Intermediate stages like 2 or 3 may requiring additional treatments such as chemotherapy or radiation. Stage 4 typically involves systemic treatments to control the spread and improve quality of life. Always discuss your staging report with your healthcare team. They can explain what the specific findings mean for your situation and help you understand your prognosis and treatment options. Remember, each person's cancer is unique, and many factors influence outcomes. Staging provides a general guide, but your individual health, tumor biology, and response to treatment are also important. In summary, understanding your colon cancer staging report involves knowing the TNM categories and overall stage, recognizing the significance of metastasis as spread to distant organs, and knowing how this information guides treatment. Always seek personalized advice from your medical team to get the most accurate interpretation and plan for your care.